From the first day of medical school in our osteopathic colleges, we are taught you will approach every single person in a whole body manner. Those philosophies are ingrained into your core, and that's a very, very powerful tool. No matter what specialty practice you go into, you will always maintain the osteopathic approach.
When you treat someone, you're not treating the disease, you're treating the patient. And by looking at them from a mental standpoint, from a physical standpoint, and a spiritual standpoint, there are many times that someone has multiple comorbidities, and you need to be able to look at all aspects of that and treat them as a whole.
We look at the patient, what they're involved in their life. Are they married? Do they have a big family? That is one of the most important things involved in people's health, is their life. And so I wanted to have that approach going into being a physician.
If the nation calls, at least at our base, as far as from a healthcare perspective, then it's my responsibility and our squadron's responsibility to try to make sure those folks are ready to go pretty quickly. We do have a lot of musculoskeletal related injuries, and so for me, as far as osteopathic profession, specifically with the OMT, is when I think I can add more benefit and value because of the additional set of anatomy and palpatory skills that we learn. And so being unafraid to lay hands on patients and try to treat them without necessarily giving them medication, because some of the times the medications that we prescribe can also cause them not to be able to do their duty for a certain period of time.
I love making people feel the way that I would want to feel and the way that my family members would want to feel. And I think as a physician, it is of utmost importance to be a compassionate physician. I want to be the team leader that people just look at and say, wow, I felt comfortable and I felt protected and I felt safe and my health was in complete good hands with that person.
As an OBGYN, I may not be doing very much OMM or osteopathic manipulative treatments, but I have a couple of those tools in my bag as well when someone who's pregnant is suffering from some low back pain. You know, there's a couple extra little things that I could do to maybe make them feel a little bit better. Those combined really are helpful to me as a physician.
We can get people to heal quicker by using osteopathic techniques. Someone has appendicitis. I'm still going to do traditional medicine, but I'm also going to use my hands to help further conclude and prove my diagnosis is accurate. Osteopathic manipulative medicine is a tool to help me diagnose. It's also a tool to treat and to incorporate into my overall practice of medicine.
We are learning how to use these. We are learning how to use our medical technology and the advances that happen every day in medical technology, learning how to incorporate that, but also with our most foundational skills like our hands and our stethoscopes to treat patients.
I chose to pursue my training in an osteopathic medical school because we're rooted in a patient-centered philosophy, and we really try to make sure that we reach each patient where they are. We treat the whole person.
Being an osteopathic physician means I'm different.
It truly fits who I am and what I want to be as a physician.
Absolutely, positively, emphatically, I choose DO.
I choose DO.